So step 2 is the physical examination. So the purpose of the physical examination is to help you as the physio confirm your diagnosis of what the patient has, what their problem is, to give you a bit more clarity, and you already gain a lot of information from the interview. And it's also to give them some reassurance of how you go through this process and to make them feel comfortable with the instructions you give them, the handling you have with them, introduce them to physical touch, and then at the end of the physical assessment, giving them some information about what you believe is wrong. So my goal of the physical assessment is to try and get the most accurate diagnosis of their problem that I can, and to be able to articulate to them in the simplest way that's possible. So again, if you've got John with the bad back, a lot of us as physios, we're not satisfied until we find out exactly what structure is wrong in the back, but does that really mean anything to John? So I'll just explain some of this to you as we go. So when I do the physical examination, I'm trying to find 3 or 4 major findings that I would call asterisk signs. So asterisk signs are things like a problem with John's posture. When he walks, it could be a sign that looks like he's limping. It could be a muscle or a joint that's stiff or sore to touch. It could be a movement that doesn't look right or is painful for him. So it could be one of the different movements that we do with our back. So they're probably the main points that I would describe as asterisk signs. Now, the reason I only want 3 or 4 is I'm really looking for the major things. Okay, so some people with a problem come in and they might have 10 or 15 different signs, but the ones that we're really looking to influence are the 3 or 4 major signs and the things that are bothering the person the most. So if someone says, I've got a bad back and I can't bend, you're going to want to do bending as a test, and you're going to want to apply a treatment or an intervention that helps them bend better. So John comes in, my physical examination looks like having him stand up, running my hands over his back, even up to his neck and down through his hips, just to get him a bit confident with my touch, which is generally, I'd say firm. And I'm saying, John, I'm just touching your back now, especially if the person's a bit sensitive, if they're in pain. And most people, I will then just get them to have a quick walk so I can see if their walk looks okay and if there's anything that doesn't look right. And then I'll have a look at their standing posture. Generally, if it's a problem from, say, the waist down, or if it's from the waist up, I'll also have a look at their sitting posture. And then I will do the appropriate movement tests for the different parts of the body, whether it's the back, the neck, the shoulder, or the knee, or whichever area you're treating. And that will include special tests for structures in that area. So ligament testing various elements of the joint, testing the nervous system as well with neural tissue sensitivity tests. And so I do the testing, and as I talk my patient through the testing, I'm saying, well, this is what we're doing now. We're looking at the muscles, and now I'm going to have a feel of your back, and I'm going to see if there's any muscles or joints that are sore or stiff. So I'm trying to explain things to them in very, very simple language. Now, after I do the physical assessment in the first consultation, I'll have the patient come back and sit down, and I'll write some notes, and I'll say, okay, what we're going to do is I'm just going to talk you through some of the things that we found from the physical assessment. And the things that we found are going to help me understand and articulate to you what your diagnosis is. And when we know your diagnosis, we're going to know how we need to start to treat this problem. So this is the transition period from the physical assessment to the treatment. So after the physical assessment, I'm going to say, John, okay, you're having trouble bending. You've got a stiff muscle on the right side of your back. You've got a stiff joint on the right side of your back. And when you walk, your hips are shifted off to the side. So I think you've got a joint problem in your lower back. So next, we're going to talk about the treatment.